welcome to another edition of the Beyond the Blade podcast. I am Dr. Zurarian from Zuri Plastic Surgery, and we wanted to talk today about menopause. It's a very important conversation that we like to have with our patients, and the importance of realizing that just because you are in menopause does not mean that you could not benefit from many of the plastic surgeries that we perform at our practice. So we want to start talking by letting everybody know all the different procedures that are applicable in this menopause time frame. One of the important ones is the eyelid surgery. So as we age, unfortunately, our eyelids and our brow starts to descend, and it starts to really cause not only a cosmetic problem, but it also causes a functional eye issue. Many of our patients who come to our clinic in their older years are experiencing some visual problems, especially when they drive at night. So upper eyelid blepharoplasty is a great surgery. It can really help to rejuvenate the upper eyelid, and it not only provides us a cosmetic benefit, it also provides us with a functional visual benefit as well. Whenever you're considering doing upper eyelid surgery, you should always think about doing a brow lift. This is very important because a lot of the extra skin that is at the upper eyelid area is actually a result of the brow that has come down due to gravity over time. And lifting the brow will also open the eyes and give you a much better cosmetic outcome. We also talk about lower eyelids. If you have those bulging lower eyelid fat pads, that extra skin to the lower eyelid, and the hollowing in certain areas, which we call the tear trough, it's a very good idea to consider doing lower blepharoplasty or lower eyelid surgery. I use a very advanced technique in all of my lower blepharoplasties, which is called a septal reset, which is basically not like the old way of doing blepharoplasties. It is the new and updated version, and I'll explain a little bit why. Part of the reason is that in the old days, the surgeons would remove all of the extra fat in the lower eyelid, and this would cause a lot of hollowing. Now there are modified techniques where only a small amount of the fat is used, and a reconstruction of the septum, which is the wall that gets loose and gets damaged over time, is reinforced, and it holds that fat pad back into the orbit or into the eye socket. So these are newer techniques that are being used. I always like to add nano fat grafting with all of my lower eyelid surgeries to basically blend the upper cheek and the lower eyelid. We want to give a smooth appearance to that location. And so fat grafting has really revolutionized this procedure. We also talk about facelifts. We talk about neck lifts as well. Those are great operations in our menopause years. And, honestly, the earlier you do these operations, the better the result that you're going to have. You're going to have a much more rejuvenated appearance if you do your facelift in your 50s than in your 60s or 70s. And part of that has to do with collagen. Collagen is a primary determinant of the quality of your skin, the elasticity, the turgor, the overall appearance. So it's important to consider this when, thinking about facial rejuvenation. The other aspect, of course, is doing a deep plane or deep plane neck facelift procedure. And this is something that I do in my practice very often to help my patients not only lift the skin of the face, but also the musculature, which has unfortunately become weak and has come down over time. The other very common procedures we do for our ladies that are in their menopause years is what we call the mommy makeover. And it's really a menopause makeover, in my opinion. And it includes breast lift surgery. It can include also the use of implants in certain cases. And it includes abdominoplasty surgery. And this is a great operation because we remove a lot of the excess and unwanted skin that women have a very difficult time getting rid of in their menopause years. We also do liposuction to give better body contouring, and we can liposuction many different areas in a very safe and predictable manner when doing these menopause makeover surgeries. So these are just some of the ideas that we can bring forth when it comes to helping our patients during menopause. Now, as also a plastic surgeon who's very focused on overall health and wellness, which is the reason why I created Hydrology Wellness here in Miami, is that we want to make sure that we study our menopause patients very, very astutely before their surgery. So we want to make sure that we get the appropriate lab testing done. We also want to make sure that they're in the best possible health before having surgery. So we always recommend getting biomarker assessments done, taking a look at your overall nutrition, being evaluated by one of our nurse practitioners at Hydrology Wellness to get a more detailed analysis using our in-body scale to figure out what is your BMI, your body mass index, what is your visceral fat component, and also how much muscular strength do you have? Because if we can optimize all of those parameters before you have surgery, you're going to have a much more successful outcome. You're going to recover faster. You're going to have less inflammation. You're going to have better wound healing. And talking about wound healing, we always have to mention hyperbaric oxygen. Hyperbaric oxygen has revolutionized my practice because my patients that engage in 2 to 3 time a week sessions of hyperbaric oxygen heal faster. Their wound healing is just so much better. Their inflammation comes down faster. They have less swelling. And all of these are amazing benefits of hyperbaric oxygen and something that you should really consider. Once you hit the menopause years, you don't have the same rapid healing capacity as you did maybe in your early teens and 20s. So at Hydrology, we try to optimize as much of your health and healing by doing IV vitamin drips, glutathione that we also recommend. These are very anti-inflammatory treatments that can really help you move forward. We also do red light therapy, which is very good for scars and overall enhances your skin's texture and appearance. And so there are a lot of different modalities that we can offer you at Hydrology, either before your surgery or after. Of course, all with the concept of giving you a very holistic plastic surgery experience. So I hope I was able to give you some information on the menopause years, on the surgeries that we most commonly perform. And if you have any questions or you'd like more information about some of these procedures, always feel free to reach out on our Instagram at Dr. Z, DRZ Plastic Surgery, or on our website at ZuriPlasticSurgery.com. Thank you for listening, and we hope to bring you another edition of the Beyond the Blade podcast very soon.